blood in the stools can present in various forms. One is the stools are stained with blood. The other is when a person goes to pass stools, blood is dripping from the anus like a tap. And the third is when the stools are totally black color with an offensive smell. They all come from the gastrointestinal tract. That means the tube from the mouth right up to the anus, which is nearly 10 meters long. So it can be from any part. And of course the most common anywhere in the world is bleeding piles or hemorrhoids. And these are external, just at the anus. And usually the blood is fresh, bright looking. And that is what really frightens the patient. So that bleeding from stools bleeding can mean any one of these. And any one of these can mean that there is something unusual lying in the gastrointestinal tract, which is from the mouth to the anus. Anywhere there could be bleeding. You see? Most common, piles. The causes, we go down from the top right to the bottom. Okay? It could be simple things like bleeding from the tonsils. The blood is swallowed by the person at night. Of course, that is not significant, and it's not attended by usually by general practitioners. And then of course coming down the esophagus, the tube here, first there's the stomach. The stomach bleeding, it could be from a gastric ulcer, and a gastric ulcer can be in the stomach, the duodenum, or any small part of the intestine. These things, if the blood really accumulates in the stomach, the person vomits out fresh blood. If it is slow bleeding, it comes down the intestinal tract slowly, and it takes days to reach the other end, by which time it is pure black and smells offensive. That's called melena, which is extremely dangerous, which means he has got an ulcer which is bleeding and he's not aware of it. Sometimes there may be no severe pain and the patient may tend to ignore it. Then coming down further, there are other illnesses like Crohn's disease, diverticulitis. These are not so common, but they can also cause bleeding. Then coming down further down, most people know where the appendix is, the right side of the hip. Very often on the left side of the hip is the large intestine called the colon. And cancer of the colon is very common, and in Singapore, it is one of the biggest killers. But if detected early, it can be treated early. And further down, of course, you got tear in the anus called fissures, they have piles, they have polyps, they have so many of these. And the basic investigation would be, number one, of course, a simple examination with the fingers, the doctor's fingers. That can detect things like polyps, piles, fissures. Next, there's an instrument called proctoscope, which you insert into the anus and examine. That too cannot examine deep ends. And the third investigation is a colonoscopy, where a long tube with a fibrooptic lens goes into the anus and goes deeper and deeper and can see the whole large intestine, and that is one way of recognizing, identifying and diagnosing cancer of the colon. On the other end, you can pass the tube through the mouth to another tube, not the same, another different tube, where you can identify cancer of the stomach and some other diseases like some bacteria which is called Helicobacter pylori, which is in the stomach, which can cause gastric pain. So these are the methods. And of course some go for scanning like ultrasonic scan, and there are blood tests, but blood tests do not really point to accurate diagnosis of bleeding from the anus, bleeding from the stools. And treatment, of course, for things like piles which are early stage, a GP usually treats with cream and suppositories, which are things which you insert into the anus at night. That is the simplest form of treatment. If that doesn't work, of course you refer to a surgeon, and the surgeon does an operation. And if cancer of the colon, of course, the only answer is an operation. But if detected early, patients with cancer of the colon can live for a very long time, almost normal length of duration of life. That is, they cut off the part that is involved in the cancer, stitch it back. It's a common procedure nowadays. And even stomach, if there's an ulcer, cut off that part of the stomach, stitch back, and he lives an almost normal life. When I say almost normal means he can eat, he can run, he can jump, but you should still avoid oily food, fatty food, chili, drinks like alcoholic drinks, smoke. Smoke is an aggravating factor. So these are the things by which a patient can prevent illnesses in his body. And of course, we recommend always, why don't you go a whole health screening? But I must emphasize that health screening does not reveal all. It only reveals some things which can be found in blood or which can be found on examination. There are a lot of things which cannot be detected on routine health screening. For example, cancer of the nose. Now, cancer of the nose is not what the nose is. It is a misnomer because the bleeding occurs through the nose. Cancer of the nose is if you draw a line from here and here where it meets at the base of the brain. If that bleeds too, person can swallow it and go down the intestine and come out in the stools.
Get connected with us at MHC.